Systematic review and meta-analysis looking at MTBI in older people. So they're calling older people 60 plus. Now, we know that after brain injury of moderate to severe categories, older people have higher mortality. So the thought is, prevailing thought in the literature is that older individuals are going to have a tougher time recovering from concussion. But this was a systematic review and meta-analysis that wanted to look at that. So they compared studies done on older age individuals versus studies that were done on younger age individuals. And they wanted to look at recovery times to see if by 3 months, there was higher chance that older individuals would experience prolonged symptoms, because that is the prevailing thought in the literature, is that the older you are, the harder it is to recover. So let's see if that actually holds true. By the 3-month follow-up, preliminary findings indicate that older adults continue to experience selective cognitive difficulties. But given the data, it is possible that these difficulties are due to generalized trauma or pre-existing cognitive impairment. In contrast, there is stronger evidence across time points that older adults do not experience elevated levels of psychological distress following injury and endorse fewer psychological symptoms than younger adults. Meta-analysis based on Glasgow Outcome Scale at 6 months post-injury indicates that a large proportion of older adults can achieve good functional recovery similar to younger adults. So it seems that there is a lot of similarities between older and younger. Although our initial review suggests some optimism and recovery from concussion in older age, there is urgent need for more investigations in this under-researched but growing demographic. So if you look here, these are the studies that are looking at older individuals. These are the studies looking at younger individuals. And you can see here that this is kind of the meta-analysis here. And you can see that this is recovered after 3 to 6 months. And this is still symptomatic after 3 to 6 months. 6 to 12 months. That's what this was. And you can see here that 0 means that if you have something that's like here, for example, look at this one. So this one, you can see that the box is above 0, meaning that it favors the recovered group. But because these tails, the confidence interval crosses 0, this means that we don't really know. Whereas something like this shows that we're fully across the 0 line with our whisker even not crossing 0. So this is a better result, showing that basically older adults recover, within that 6 to 12 months, and it's pretty, high likelihood of recovery. Now you can see here that overall, when you combine all the studies, this diamond is the combination of all of them, and it does kind of cross 0. But if you look here, most of the studies in the younger adults are actually the ones that are closer to this line and closer to still having symptoms, whereas the older adult ones tend to be over here. You can see this diamond here. Overall, it tends to be above that 0 marker, right, in the older group. So it looks as though older adults are, just as likely to have a significant recovery by that time as younger adults. So more evidence needed is what they say.